let me turn now to Medicare, another key concern of AARP. According to Medicare trustees, Medicare can pay full benefits for about 10 years and 90% of private hospital benefits after that. Approximately 99% of Hawaii seniors are enrolled in Medicare. So my question is this: Medicare is the foundation of health security for older Americans, including more than 210,000 Medicare beneficiaries in Hawaii. What do you think is the biggest challenge facing Medicare? Ms. Hirono?
One of the biggest challenges, of course, is the rising cost of health care, and not just for Medicare, but for our entire country. So when we fought so hard to pass the Affordable Care Act, there are provisions in that Affordable Care Act that directly addresses Medicare. First of all, we want the seniors to be able to get preventive care, checkups, without having to copay. We want our seniors to be able to afford drugs, prescription drugs, so the Affordable Care Act lowers those costs. We want to close that donut hole so that you can get the medications that you need. In addition, it's been identified that there's a lot of fraud and waste in Medicare. And over the 10 years, by attacking vehemently fraud and waste in the Medicare system, we could save that system $600 billion over 10 years. And we put in some fraud, anti-fraud provisions in the Affordable Care Act, but obviously we need to go after fraud like nobody's business.
Case?
You know, one of the challenges of leadership in our country today is simply being honest with folks about what the situation is. What do we actually face and why? The reason that we face a challenge with Social Security and Medicare is that we have more retirees living longer for fewer people in the workforce. That's a demographic fact, and that is the fact of what we are addressing here today. So the biggest challenge with Medicare is exactly the same challenge as with Social Security, and that is to maintain its fiscal solvency so that the next generations can benefit from it, just as our generation, your generation, and other generations have before. And the same basic ingredients apply. Can you rebalance the revenue and the expense side? Now, I agree with Macy that the other huge challenge of Medicare, which is not part of Social Security, is controlling healthcare costs. And yes, I do believe and agree that the Affordable Care Act was a major ingredient in terms of reining in those costs, but we have unfinished business, and we've got to go after that as well.
Thank you. Let me ask you another Medicare question here. Medicare doesn't provide coverage for all seniors' health needs. On average, Hawaii beneficiaries spend nearly $5,000 out of pocket on health care costs each year. How would you put Medicare on stronger financial ground and strengthen it for future generations? Ms. Hirono?
I think closing the donut hole would help tremendously. In fact, the people who got into the donut hole last year, were given $250. And I heard from seniors who said that $250 made a difference in their lives. So every dime counts for seniors. We need to close that donut hole. But guess what? The first thing that the Republicans did, and when they took control of the House, was to totally repeal the Affordable Care Act. So that means that there's going to be very bad consequences for seniors as well as a lot of other people in our country. One thing we ought to do, in my opinion, on Medicare is to allow for bulk purchase of drugs. When the Medicare Part D was first created, there was a huge battle over those kinds of issues. And I think that if we could bulk purchase drugs for Medicare, that would bring down costs tremendously for that system.
Mr. Case?
Well, I think, again, we are agreeing in substance and perhaps disagreeing on some priorities. Again, the Affordable Care Act did, in fact, go after the donut hole. That's one of the reasons why I supported it and do believe it needs to be continued. But in the big picture, I think one of the things we have to do with both Social Security and Medicare is do much more means testing, by which I mean that those that can afford chip in more for their own expenses. Medicare and Social Security were designed as insurance programs to take care of those that didn't have enough to take care of themselves. They were not designed to subsidize high-wealth individuals a little bit extra in their lives. And so as we go back to means testing with Medicare, we can accomplish some of those savings that will allow us to focus the needs of Medicare in on the citizens of our country and state that really need it. Now, we can also, I agree with Maisie on bulk purchasing of drugs. I introduced that when I was in Congress. I would pursue that again. But one major ingredient that we can do right here is to get a much better physician's reimbursement schedule for Medicare payments. That's driving our physicians off of Maui, off of the neighbor islands, out of Hawaii. We fix that, we'll take care of Hawaii in a big way.
Okay. Would you favor moving to a market-based model in which beneficiaries buy plans from private insurance companies? Mr. Hirono?
Definitely not. That is exactly what the Republicans are trying to do. They're basically trying to privatize Medicare and change it into a whole new kind of program where seniors will get vouchers. And they also want to increase the eligibility for Medicare from what it is now to age 67. Imagine yourself, you're age 67, you get a voucher, and you're supposed to go out there in the marketplace and find an insurance company that is going to insure you with probably pre-existing conditions. It's not going to happen. So that is one of the worst ideas that I've heard of in terms of how to so-called fix Medicare. It is going to do tremendous damage to our seniors. It's going to compromise their health care. And not only that, this process will mean that the seniors will end up paying more and more and more and more of the health care costs themselves. You think a $5,000 out of pocket is a lot? Think what it's going to be when you have to go out there and get your insurance for yourself in the marketplace.
Mr. Case?
I oppose the privatization of Medicare. I oppose vouchers for Medicare. I oppose any proposal, whether it's in the Paul Ryan budget or any other Republican proposal or any other party's proposal for that matter, that fundamentally alters the basic aspect of Medicare, which is to provide people with insurance against their medical needs. The assurance that they can get their medical needs taken care of. Now, I think as we look at medical delivery in our country, Medicare and other systems out there, what I don't believe in is Medicare taking over for the entirety of the medical delivery system. I do believe that there's a place for private medical care delivery and insurance in our country, and that we need both, really, to provide a great medical delivery system in our country. And so I'm willing to take a look at some ideas like health savings accounts that allow people some flexibility in where they direct their medical expenses, as long as it doesn't take away from the basics of Medicare.
Thank you. Let me turn now to retirement security. We're all interested in this issue of retirement security. According to the Federal Reserve's recent survey of consumer finances, more families say they are saving as a precautionary measure in the near term, but fewer say they are saving for retirement. What would you do to help and encourage Hawaii residents to build their personal savings and investment in preparation for retirement? Mr. Hirono?
When we had this huge battle over Wall Street reform to rein in the excesses of what was going on in Wall Street, which brought our country to the brink of economic chaos, and in fact we're still in the worst recession since the Great Depression, there were provisions in that bill that really fostered and supported economic or financial literacy. I think that's really important. People need to know from very early on how important it is to save for retirement, and it's never too late to start. And of course we can provide incentives for that kind of retirement savings. I think that the financial literacy in our country is not what it should be. I think there have been studies that show that. And that is why we fought really hard for that provision, that kind of provision to be put into the Wall Street Reform Act.
Mr. Case?
We want to continue to incentivize private savings and private investment in pensions. We want to do that because we cannot rely on Social Security alone to provide for all of our savings, our retirement savings for all of us. And so the programs that our government has adopted over the last decades to incentivize folks to put their money aside should all be continued. We have all taken a hit on our private retirement savings over the last couple of years, which has been a wake-up call to many, many, many millions of Americans across the board. People are working longer, living not as well, and it means that we have to continue these programs and to take care of the short-term consequences. 3 specific proposals I think we need to look at. First of all, I think there is a place for a temporary retirement account loss deduction as long as it's paid for and affordable. Second, I would consider a federal match for savings into pensions by those under 35 years old, as long as it was affordable. And finally, allow automatic consolidation of 401ks as you change jobs.
Thank you. Well, let me go to this question. The so-called Bush tax cuts are scheduled to expire at the end of the year. This means that all tax brackets would be raised, and the tax on capital gains and dividends would be raised. Do you support the expiration of these tax cuts? Ms. Hirono?
I have been very vocal in my support for the sunsetting of the Bush tax cuts for the richest 2% of the people in our country, who benefited, by the way, 80% from these Bush tax cuts, and the rest of the country got, 20%. Well, how fair is that? So, of course, we need tax fairness in our country, and everyone needs to pay their fair share. So, yes, I strongly support the elimination of the tax cuts, and also for the richest people, the capital gains taxes, which I know that Ed supported when he was in Congress. In addition, we need to get rid of the corporate welfare. The oil industry does not need $4 billion every single year of our money. That money should stop, and it should go into research and development of alternative and renewable fuels, so that all of us, I hope, will be able to pay less for electricity and gasoline in this state.
Gates?
In 2003, as your congressman, I voted against the Bush tax cuts. I voted against them because I thought they were unfair, unaffordable, and not necessary for economic recovery. And thus, if I were in Congress today and were asked, would I continue those tax cuts on the upper income past the sunset date of the end of this year, my answer would be absolutely not. I don't believe that we need to do that to continue with economic recovery. Now, one of the differences, in all honesty, between me and Maisie is this. Yes, we need to have a progressive tax system. But at some point, if you load the taxes up too much on those that are making more than others, you're going to chill economic activity. I have no problem, for example, with the income tax cuts going back to their level. Capital gains taxes are designed to incentivize investment back into our jobs. When you lift the cap on Social Security, that's okay. When you abolish it, you chill economic activity. It's all in the balance. You can't always do it in that side of the equation.